And here's that condition I referred to earlier, anaphylaxis. Maybe some of you have heard of this before. Maybe some of you have this particular situation that you have to manage for yourself. It is a life-threatening allergic reaction. We're not going to break this word down for you. I just want you to learn anaphylaxis being what it is, which is exactly as I described it. In essence, anaphylaxis is the overreaction of the immune system to some form of allergic exposure. Ironically enough, the same sort of thing happens with COVID, although not exactly like this. In case of COVID, our body, meaning our immune system, overreacts. And that's usually what causes the complications with COVID. And anaphylaxis is, as I said, it's a life-threatening allergic reaction. So there's an allergen present that causes this reaction to engage. You can see an illustration of a classic anaphylactic patient in the lower right here. I've seen this on a few people, and it's pretty frightening. It's a very rapid onset usually. If you've ever been in the doctor's office and gotten an injection and we said, okay, you have to sit here in this chair and wait for 15 minutes, it's because we wanted to be sure this type of reaction wouldn't happen to you. It can happen with food. It can happen with bee stings. So if you have bee allergies, anything like that. There is a drug called epinephrine. It's very, well, it used to be very cheap before some of the big pharmaceutical companies made it very expensive. But in essence, it's a very cheap medication that will calm this reaction down. So in an anaphylactic response, within 30 to 90 seconds after exposure, hives are going to appear. There's going to be some minor swelling of the tongue and some minor swelling of the throat tissues. So you often see the onset of anaphylactic reaction being that someone trying to clear they're trying to clear their throat, possibly having difficulty breathing or feeling like they have sort of an asthmatic type of effect. Then the edema component will really kick in. So this is the second stage. After the initial onset, there's some discomfort. And those who know anaphylaxis will know this reaction's coming on. Then the tongue begins to swell and it fills the entire mouth cavity and blocks off the back of the throat so that one couldn't breathe through the mouth. But the inflammation, or rather, the inflammation or swelling will then continue into the back of the pharynx and that will swell shut. Now breathing through the nose or the mouth is an impossibility. So there is no way to get oxygen in this patient. You could perform CPR, but it's not going to get air into their lungs. The only thing, once this is fully manifested, that will turn it around is something called epinephrine. Once it's administered within about 15 to 20 seconds, the symptoms ease and the patient's back to kind of normal. Those who know they have anaphylaxis and have had reactions before will carry what's called an EpiPen, and that's a pen that has epinephrine in it. It's an already loaded syringe, if you will, with a mechanism. They usually inject it in the thigh, and you just sort of hit that on the thigh. It will engage a needle, which will inject the epinephrine and will stop this reaction. If you ever have a patient who has this reaction while you're with them, you need to get a physician, and the physician can help administer epinephrine. If the patient has their own EpiPen, they can administer their own. And if they have a pen and they can't administer and there's no doc around, by this point in your training, you will have learned how to use an EpiPen and you'll administer it yourself. I've seen this a few times. It's pretty alarming when it happens. It kind of takes you by surprise if you've never seen it before. It is a thing. My wife had it in the classroom once with a child with peanut allergies, and it was, it got everyone's attention. Let's put it that way. That's enough about anaphylaxis. I just want to emphasize the importance of it. I've seen it a few times when people didn't really take it seriously, and the end result was not such a positive one. All right, so there you go. There's anaphylaxis. Moving on to our tonsils, I want you to note here spelling. We have tonsillo as a combining form for tonsil, and you'll notice that the medical combining form has two L's, but the one that we use in our common vernacular, our common language, has only one L. That's to note here because spelling matters, right? Some of the words, tonsillitis. Well, there's another itis for you, that inflammation of the tonsils. A tonsillectomy is excision of the tonsils. And something that's peritonsillar is pertaining to the area around the tonsils. For instance, if you look at the tonsils here in the lower left, there is definitely a condition going on around them. And to be honest with you, that, ladies and gentlemen, is strep throat. And there's patches of white material there are expired white blood cells. They've come to fight infection, and now they're kind of hanging out there. So when we see that type of classic thing, and those tonsils are quite swollen, we know that we're looking at strep throat, generally speaking, and treat as needed. Tonsils can be removed if chronic infections become a problem for the patient. Maybe some of you have had a tonsillectomy. So moving further down the throat, we have laryngo, in other words, the larynx or the voice box. So laryngo is the combining form, larynx is the voice box. This is that chunk of cartilage you have in your neck that we call the thyroid cartilage. The larynx lies right directly behind that. It is often called the Adam's apple, so maybe you've heard that reference before, and if you have, that's what they're referring to. Once again, laryngo is the combining form. Laryngitis is inflammation of the larynx, which often causes a hoarse throat. So people who have a hoarse throat will often say they have laryngitis, and quite frankly, they're probably correct. If a doctor has to look down there, they're going to use something called a laryngoscope, and you see an illustration of that down in the lower right corner of the frame. And when they are performing that, remember, there's the Y, so it's a procedure. A laryngoscopy is a visual examination of the larynx. So inferior to the larynx, as we move further down, we have the trachea. If you were to go right below your Adam's apple and right above that sternal notch, that little notch you have right at the top of the chest in the front, right in between there's about 1.5 inches or 2 of space. And if you palpate that while you're speaking, you'll feel it vibrate. And if you are feeling that vibration, you're palpating your trachea. It's right there. There's the windpipe. That is a direct route into your lungs. Its combining form is tracheo. And some of the words that we would use, and this first word would apply to anaphylaxis, would be tracheostenosis, narrowing of the trachea. So the swelling from anaphylaxis might go as low as the trachea. Usually it happens more around the pharynx and above the larynx, but it could be below that as well. You could have a tracheotomy, which is an incision of the trachea, and a tracheostomy, which would be forming a new opening in the trachea. So you see the illustration of a tracheostomy here in the lower portion of the frame. So if there's any sort of breathing obstruction that's happening superior to the pharynx and superior to the larynx, if there's an obstruction, they can do the tracheostomy, which, as you see, is inferior to the larynx, and they open that area up and they can insert a tube right there. So if you palpate that area, you'll feel the rings of cartilage, and you'll also feel exactly where they would place a tracheostomy, which is commonly called in medicine a trach. If you ever go into an ICU, you will see lots of patients, often in medically induced comas, with this apparatus on the right, on their neck, and that's what you're looking at. That's providing air straight to the lungs. It's bypassing the mouth, and of course the nasal passages, the sinuses, the nose, all of that, and the air is coming in through here, and a specific reason for that. It's to keep the patient, to keep them alive, so they have an oxygen supply. Also, when you see a tracheostomy, very often the patient will be, as I said earlier, in a medically induced coma. Pardon my mispronunciation there. Okay, so there's what you need to know about the upper respiratory tract. We're going to look at the lower respiratory tract, and we're going to be looking at the bronchi, the bronchioles, the alveoli, and the lungs. Here we go. Bronchi is our first combining form. Do note that the combining vowel here is an I, hence the asterisk next to it. Bronchi is the combining form for bronchus. Bronchus is a plural. And bronchi, to all the way to the far right, bronchus is singular. Bronchi, all the way to the right in parentheses, is the plural of bronchus. Do not confuse that with the combining form, even though I know they look the same, except the combining form has a slash. Bronchi is the combining form, the one on the left. The one on the right is bronchi as in plural, as in two bronchus. So bronchi, or bronchi, these are the left and right divisions that branch off of the trachea. If we want to talk about them, we put them in the context of a pertaining to, and we say bronchial. So you could have a bronchial obstruction, let's say, God forbid, which would make breathing difficult. And bronchiectasis, dilation of the bronchi. And that's a chronic disorder, and usually associated with some components of certain types of asthma. So when breathing becomes difficult, the bronchi have some inflammation, and it's hard for the air to move through it. Usually there's mucus involved and such. But the thing I want you to take away from this slide is that there's not only one combining form for the bronchus, there are two combining forms. Here's the other one, and it's the more common one. And note the only thing that changed was the combining vowel went from I to O. And it still means bronchus, and that bronchi you see in parentheses still means plural for bronchus. But broncho is a combining form that also means bronchus, as in bronchitis, inflammation of the bronchi. That's an upper respiratory, or pardon me, a lower respiratory infection that sometimes happens as a secondary infection after a cold. If a doctor needed to look down there, they would use a bronchoscope. It's a lighted instrument for viewing the bronchi. And if they were doing this, now note the pronunciation, as you've seen previously, if they're using a bronchoscope, they are engaged in the act of bronchoscopy. There's our Y, so it's a procedure. It's a visual examination of the bronchus. You may have a bronchospasm, which is an involuntary contraction of the bronchus. You may have bronchostenosis, or your patient may have this, and this means a narrowing of the bronchus. So any of those the last two, either the last two or bronchitis at the top, they all affect our breathing and how well we can breathe. Bronchitis usually has a type of very distinct raspy, sort of wet-sounding cough. And specifically on bronchitis, inflammation of the mucous membranes lining the bronchial airways. So that's specifically when we talk about bronchitis. If you've ever heard about COPD, oh, it jumped out of my head. I'll get back to it in just a moment. But COPD is a series of bronchial and respiratory disorders that usually happen as a result of smoking cigarettes. You see that illustrated here in the lower right. COPD is, the bronchitis is one of the components. We have one type of bronchitis that's more dealing with just inflamed bronchi. That's usually a viral, a bacterial infection. The one you see on the right is a chronic situation that is the result of smoking, and that's chronic obstructive pulmonary disorder or disease is COPD. Chronic obstructive pulmonary disorder. We'll talk about that a little bit later. Bronchodilator is something you give someone who has asthma. This is a drug that's used to open up air passages of the lungs. It dilates those constricted airways, relaxes the smooth muscles surrounding the bronchioles and the bronchi. So this is a miracle drug. Before this, people with asthma would suffer just really bad medical situations as a result of not being able to breathe. If you have bronchitis or ever seen anyone with a bronchitis reaction, it's concerning. It's sort of like seeing anaphylaxis, not nearly as severe, but definitely it's an attention getter. And if you have it yourself and you have a moment where you can't catch your breath, that's a very dramatic moment. So bronchodilators are very inexpensive, thankfully still inexpensive medication that will turn that effect around immediately, and it's called a bronchodilator, and it will open those bronchioles up, and you'll be able to breathe much better. And speaking of bronchioles, since I just mentioned them, their combining form is bronchiolo. So it's kind of the same as the actual word itself. You just take the E off and add an O. So you'll see here in the diagram, you have a primary bronchus. That goes to a secondary bronchus. That goes to a tertiary bronchus. And at the end of that, you have something called the bronchiole. And that's a very, very small, in diameter, very small lumen bronchi, if you will, or bronchus, that then terminates at the alveoli. We'll get into those in just a moment. What I do want you to take away from this slide are not only these two words, but also the idea that in the respiratory system, and as you're seeing right here, we have a big pipe, and that's the trachea, that goes into a smaller pipe. That's the bronchus. Goes into yet a smaller pipe, into the secondary bronchus. And the tertiary is even yet smaller. So it goes from large to small to smaller to smallest. You're going to see that in our next chapter as well, the cardiovascular system. So it's a concept I want you to be comfortable with. The bronchioles are small, fine branches of the bronchi, and bronchiolitis is inflammation of the bronchioles. And this is where asthma really happens. These small tubes will fill with mucus. They will constrict. It's hard to get oxygen into the alveoli, and you'll find out about those in just a moment. And this is the reaction we have in asthma. So a bronchodilator will open all of that up, and it does it almost instantaneously. That's right to 15 minutes. I'm going to pause here. I'll be back in just one moment.